5 exercises of Tibetan monks. What problems can Tibetan gymnastics help to solve? How to do the exercises. When should you refrain from doing the exercises? Watch the video to the end, and we'll tell you how to do exercises that are useful for the whole body and not very complicated. Movement is life. Many people know this expression. But doing special exercises from Tibetan monks means health, activity, and long life. What problems can Tibetan gymnastics help to solve? Tibetan gymnastics has improved health and prolonged the active life of generations of people living in different countries around the world. These simple exercises allow you to balance the internal energy in the body. A person stays healthy if his internal energy resources work properly. With just 5 exercises, it is possible to adjust the activity of the endocrine glands, which means that the production of hormones will occur in the right mode. Recall that hormones are biologically active substances that determine the functioning of each organ and the correctness of biochemical reactions in the body. They are produced in the glands of internal secretion, which include hypophysis, thyroid and pancreas, adrenal glands, ovaries in women, testicles in men, pineal gland, hypothalamus. Thus, Tibetan gymnastics regulates the condition of the whole body by regulating the synthesis of hormones. By compensating the arising abnormalities, it has a revitalizing effect, increases working capacity, and delays the onset of aging. The exercises will help both men and women to recover. If you exercise regularly, every day, you can notice positive changes in the body after 3 months. The skin condition will improve, it will become firm and elastic, it will become fresh and radiant, it will get rid of pigmentation and acne. Nails will stop breaking and breaking. Hair will become lush and dense, regain its usual shade, and the graying will be reduced. Muscles will be strong, the turgor of muscle fibers will increase. The spine will stop bothering you, and joint pain will be less frequent. Your mood will improve and your physical and mental performance will increase. Interest in life will return, weakness and fatigue will pass. Memory and attention will be restored, headaches will go away, and sleep will improve. Vision and hearing will become clearer. The gastrointestinal tract will stop bothering you. The optimum weight will be restored. Problems related to the reproductive system will go away. The work of the heart and the condition of the blood vessels are optimized. Increase immunity resistance to infections. Under the influence of correctly and regularly performed exercises, only positive changes will occur in the entire body and the energy potential of every cell will increase. How do I do the exercises? It is important to perform exercises to restore the inner energy from the Tibetan monks on a regular basis. In addition, it is necessary to exercise on an empty stomach. The stomach must be empty. Do such a mini workout once a day, preferably in the morning. It is optimal to perform each movement 21 times, as recommended by the founders of such classes, based on the fact that this is the number of repetitions maximally revitalizes the internal energy. Start with a minimum number of times, for example, 3 times for each exercise, and gradually increase to the recommended number. Remember to breathe correctly, don't rush, and if you feel discomfort during the exercise, stop and wait until you feel better. Dizziness, fatigue, and weakness may occur. If necessary, take breaks. For this, a couple of times deeply inhale and exhale completely. Here are the exercises themselves. Exercise number 1 will awaken the body's energy, activate all systems, and train the vestibular apparatus. Performed from a standing position. Arms should be spread out to the sides parallel to the floor. Rotate around your own axis in a clockwise direction. Do it slowly at first, and 3 times is enough for the first time. Gradually increase the number of turns and increase the speed. But do not do it through force. If you feel dizzy, stop and crouch down so that you don't lose your balance. Exercise number 2 is necessary to accelerate the spread of energy in the lumbar spine and abdomen. This exercise is designed to improve the digestive and genitourinary systems, as well as the thyroid gland. Some people may have difficulties when performing it, but gradually each person is sure to cope. Lying on the floor on an inhale, you have to lift your straight legs and simultaneously raise your head. It turns out that the head and legs go towards each other. As you exhale, slowly return to the starting position. It is very important to breathe correctly. If difficulties arise, fatigue arises, you can take a break while continuing to breathe deeply. Exercise number 3 increases the tone of the back and neck muscles and stimulates the joints. Starting position is kneeling. Palms rest on hips, chin resting on chest. Slowly bending backwards as you inhale, lean your head back and try to bring your shoulder blades together. Then as you exhale, take the starting position. Exercise number 4 helps to store energy for the pelvic organs and limb muscles. Initial position is sitting on a hard surface, back straight, legs shoulder width apart, fingers and toes pointed forward. As you inhale, one should come off the floor, bringing the body parallel to the floor. As you exhale, return to the starting position. As you breathe in as much as possible, tense all your muscles and then exhale, returning to the sitting position. Exercise number 5. Start by standing on your stomach, resting your feet and hands, with your head tilted back. As you breathe in, move your buttocks upward to form a triangle. As you exhale, return to the starting position. This workout spreads energy to the upper half of the torso and helps the limb muscles. When should I refrain from these activities? The ability to perform a set of exercises depends on the physical condition of the person. Even in a gentle mode, exercise is contraindicated in persistent high blood pressure, hypertension that has a crisis course. If there is cardiovascular insufficiency, frequent pain in the heart area, coronary heart disease with angina attacks or heart defects are diagnosed. Have had surgical treatment for heart disease. This could be bypass surgery or valve replacement. In the presence of serious problems with the spine in the form of protrusion, hernia, the frequent development of radicular syndrome. During pregnancy, even in the small terms. When multiple sclerosis is diagnosed, there are clear neurological symptoms. In each case, the question of the possibility of exercising is decided individually. It is necessary to consult with your doctor, especially for the elderly and people with chronic diseases.